So we'll move now to this topic. What is public health about?
We carefully read your contributions and how you try to define public health and what you consider to be the key elements. And I was happy to find back several times some key words such as population. It's about the health of a population. Health, some focus more on health being absence of diseases. But I was also happy to find the word well-being a few times. Health defined as well-being in a broad sense. But then, coming from the definition to more concrete examples, I felt that you focused a lot on things like sanitation, the control of specific infectious diseases, control of environmental conditions. And then if I compare that with what I perceive to be the view on public health within our department, I find your contributions more narrow, more specific. I think we have a broader view. And so that's the first question I would like to ask you, Bart. How do you see public health?
Well, definitely, I agree, Tine. It's broader than only this population focus. Now, perhaps rather than giving a sort of textbook definition of what public health is, very briefly, a few words on how I discovered public health. I was trained as a medical doctor in this country, and the training then, and still to a large extent today, is very much geared on individual patient care, I mean. And so in my work here as a general practitioner or hospital doctor, this was very much focused on individuals, which is sort of the norm here. It's the way things are done. It's what doctors do. And then I left for the DRC, where very quickly I became aware of the need and the relevance to take a look at the wider picture. Not only focus on individual patient care, because the needs are so huge that you do not do much else than that. And in addition, you are confronted with the fact that you may help people to recover a bit, but they return in an environment that is not necessarily conducive for their health. They are confronted to a certain number of diseases that one needs to control. They are living in, let's say, in an environment that leads to illness because of, let's say, water, sanitation. And so there is progressively the need to look at the wider picture, not only to look at individual patient care, curative care, but also to look at prevention and promotion, but also trying to address, to the extent of the leverage we have, to try to address the environment and improve the environment so that it becomes more conducive to people's health. Now, I think what is, for me, an important message in that wider picture is not to forget about individual patient-centered care. It's very central in shaping people's acceptability of the system, because it's something people, you know, when you are ill, you're in very strong demand to get helped. And then you want a system that helps you, and this creates somehow, this is the basis of some trust between initially perhaps individual people and the health system. And it gives room to address issues, to implement policies that are perhaps less demand-driven. Prevention, promotion, certainly prevention is not something that is very central in people's demands, because by definition, prevention targets healthy people. But if you meet people when they are ill and you address this issue, you can perhaps prevent this problem, and you have a good relationship with these people, well, they're likely to, because they trust you, say, well, let's give it a chance indeed, and follow the health system in that direction. So I think individual patient-centered care is central in public health, but it's not the only dimension, but it's central because it shapes trust, because it creates a platform to do more. But on the other hand, it needs to be optimized, balanced with more collective, more population-targeted interventions, more top-down interventions. So the challenge is really to reach a balance between the two. only population approach, I think is problematic. Only individual approach is also problematic.
If I hear Bart, then I see two opposite poles or two other ways of getting, to get this experience with public health. For doctors, everything starts very often with individual care, and they discover public health, the bigger picture. I have the impression when I read your contributions that you see the bigger picture, but have forgotten a little bit the importance of the individual care, the access to care, and how important this is for people. And I think if we try to balance for both groups, the doctors and the animal health physicians, then we can get a better understanding of each other.